You mentioned that you're 27 weeks along and you've had issues with varicose veins during this pregnancy. It's your second. You had it with your first. It seems to be worse this time. You talked with your doctor about it and they said just to wear support hose. You've also noticed that it gets worse when you exercise, so you're wondering if you should keep exercising or not. I had a few thoughts when I read your question, and let's start out with what varicose veins are. Varicose veins are basically swollen, bulgy veins, and a lot of women experience them in their legs, especially behind their knees, and some even experience them in the vaginal area, and they can be very uncomfortable. It can leave you with a full achy feeling. The skin around it can be red, itchy, even feel like it's burning. And so if a woman has them, they should talk with their doctor, and in a lot of instances, they do recommend support hose like your doctor said. The reason why these are helpful is because they improve circulation, and it goes back to the reason for them in the first place. A lot of pregnant women get them because the weight of the growing baby in uterus is compressing the main vein that brings blood from your legs back to your heart. In addition, during pregnancy, you have increased blood volume, and so all of this is a perfect recipe for it to slow down and get sluggish in your legs. So that's what causes it to accumulate, and the veins start to bulge, and you get varicose veins. A lot of women notice that after they deliver, they get a little bit better, but if they don't go away, there are treatments for that, and you can talk to a vein specialist afterwards if you're still having issues. In the meantime, though, keep exercising. This is actually one of the things that usually helps to improve symptoms related to varicose veins because it keeps circulation going throughout your body. Also, elevate your feet whenever you have the chance. So if you're just resting at night, put your feet up. Get a box or a laundry basket or pillows or whatever, and make sure that your feet are higher than the rest of your body. And it doesn't have to be extreme, but just enough for gravity to help blood to flow back to your heart and not accumulate in your legs. If you're going to be on your feet for long periods of time during the day, then expect it to get worse. If you can, alternate between periods of standing and sitting. Also avoid crossing your legs because that will make it worse. And give the support hose a shot. Even though you feel like they'll be uncomfortable during the summer because it's hot, you can at least try them and see if it works and then make a decision about which is worse, the discomfort of varicose veins or the extra heat you feel because you have those stockings on your legs. Good luck with everything, and if you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.